Hi, this is a continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Cough is a common symptom presenting at the primary care physician's office. There are a wide range of causes, such as bronchitis, either acute or chronic. Bronchitis is an inflammation of the bronchi, and these are tubes that carry air to and from the lungs. Lower respiratory disease, such as pneumonia, asthma, gastrointestinal reflux, upper respiratory disease that affects the nasal area, throat, and pharynx, postnasal drip, particularly after bedtime. The most common causes of cough are acute upper respiratory infections, acute bronchitis, or postnasal drip caused by a sinusitis, an inflammation or infection of the sinuses. The character of the cough can provide important clues to the cause of the cough. A brassy cough may indicate tracheitis, an inflammation of the trachea, or bronchitis. A barking cough may indicate laryngeal disorders, such as laryngitis or croup. A paroxysmal cough may indicate whooping cough. The timing of the cough may also give clues to causation. Nighttime coughing may indicate asthma, a postnasal drip, chronic bronchitis. Again, bronchitis is an inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. Whooping cough. Whooping cough, also called pertussis, is a highly contagious respiratory tract infection. In many people, it's marked by a severe hacking cough, followed by a high-pitched intake of breath that sounds like whoop, or congestive heart failure. Waking cough may indicate bronchiectasis, which is a chronic condition where the walls of the bronchi are thickened from inflammation and infection. Or lung abscess, which is a localized infection within the lung. An abscess is a pus-containing cavity. Cough after meals may indicate a hiatal hernia. A hiatal hernia occurs when the upper part of your stomach bulges through the large muscle separating your abdomen and chest. This muscle is called the diaphragm. Or disorders of the esophagus. Wheezing may indicate asthma. Congestive heart failure, which occurs when your heart muscle doesn't pump as well as it should. Or airway obstruction. Part of the process of diagnosis is the examination of sputum. Sputum is the bronchial secretions that are pushed up towards the trachea by cilia in the respiratory system. This is the way the body clears these secretions from the respiratory tract. The secretions are usually swallowed by the patient, and usually without the patient's awareness. A cough may bring the mucus upward into the pharyngeal or throat area. Normal or uninfected sputum is clear or white. Yellow or green, called purulent, is usually due to white blood cells in the sputum. White blood cells that have been fighting disease. The disease may be bacterial or due to asthma. Thick and sticky sputum may also be an indication of asthma. Clear, mucoid sputum may indicate a viral disorder. Copious and foul smelling may indicate a lung abscess or bronchiectasis. Pink frothy sputum may indicate pulmonary edema. Pulmonary edema is a condition caused by excess fluid in the lungs. This fluid collects in the numerous air sacs in the lungs, making it difficult to breathe. It may be caused by heart and non-heart related diseases. Blood-stained sputum, called hemoptysis, must be investigated. It must be distinguished from blood flecks caused by sinusitis or nasal bleeding from more insidious causes such as bronchiectasis or tuberculosis. The next videos on cough will expand our discussion of cough. Well, I hope this helps. Have a good day.